started, so thanks for coming today. We should have plenty of time for discussion, so look forward to that part as well. So if you have questions, we can just jot them down and we'll have some good discussion at the end. So Matt Ohrt, I mentioned I grew up in Iowa on a farm, but I've been in Wisconsin, so I hail from Wisconsin now, right in the center of the state. Been there about 15 years or so. Just a little bit about my background of who's up here talking. So I speak with the employer voice. I probably will till the day I die, but I've been 23 years in my professional career as an employer, working for different companies. And most recently was the VP of HR. Some of this was added later, and medical services once we had success at Merrill Steel. Merrill Steel is a steel fabricator, largest in the Midwest. We had shaped steel, and then we ship it off to build really cool things like the Bucs Stadium and football stadiums and so forth and different things. But about 900 members there just 3 weeks ago. So like the end of this week is third week, but I've always been entrepreneurial in nature. I've started a business with another colleague, and we're calling it Self-Fund Health. And we'll see in a little bit, but I had led a success story for healthcare at Merrill Steel. And we'll talk about that. When we look at the number of success stories in Wisconsin, they're few. I think that might be typical of states, like when we say success, saving big dollars, increasing free services, et cetera. There's 4 that I would say in Wisconsin. That's one of them. Pat's, who's right here, happens to be one of those. We got half of the success stories in the room. But just, yeah, it is. And then also in that journey about 4 years ago, had founded, it started out with like 5 people, but what we call the healthcare best practice group in Wisconsin. It's very informal. There's no membership. It's kind of like an email list, and then we get together a few times a year with events. But that's grown to 120 employers and 150 other entities like providers and stuff. And I actually have a sign-up sheet. I'll talk more at the end, but there's a sign-up sheet back there if you'd like to be a part of that. Would love to have you. So throughout that Merrill Steel journey, we started to get noticed. We had saved a lot of money, over $5 million in 5 years, and then added a whole bunch of free services. We'll talk about that. But we got noticed, and then you probably heard me, if you heard yesterday, I always kind of joke, I'm an Iowa farm boy, so I just always love the farm and love Iowa. And I always say, people think there's nothing but corn in Iowa, but I say that's not true because we also have soybeans. So just remember that, right? My wife and I are foster parents. We've been foster parents for about 4 years. And I call it our second batch, but we had 4. Youngest is 13, oldest is 24, married, moved out, and pregnant. But then we're starting our second batch, so we got babies running around, and we've been adopting them, usually drug situations. So a little about me. Thank you. Yeah, right. Yeah, it's challenging, but worth it, right? Like a lot of things. So, like healthcare. So. This is just a little bit about the Merrill Steel story. And I'll tell you, right, it's when you look back or when you're speaking from this place and it's like, yeah, look at this great story. But when you start, it was just, hey, let's try something. Didn't know almost anything that I know today about the healthcare, how to win. And it turns into this story with awards and stuff, but just always know there's that starting point where no one even, who cares anyway, right? But knows your name or knows what you've done. And every journey starts with a first step. We started a clinic. We had invested on site for about 600 members. We had invested $250,000 in that clinic to remodel above the lobby. And in about 3 months, we had that $250,000 back. And then the owners were like, we're on to something here. Go, do more. So we followed that with all those things. On-site MRI. A mobile clinic, we bought a used ambulance, and it was pretty fun. So, and then when you implement those savings and techniques, then you save them year after year. So it's usually not a one-time thing, right? It's over and over and over. So that's my background. If you can see that, but I had mentioned if you're in employer shoes or if you're a broker supporting an employer, I don't know if this is every state. It feels like this is a national issue, that if you're in those shoes and you want to improve healthcare, as in lower cost, increased accessibility or quality, it feels like for every problem you try to solve, there's like 5 things in your way. And I think it's sometimes overwhelming. Like, okay, well, let's fix that. And you're like, well, we could, but there's this and this and this and this and this. I'm like, oh, well, I got another job too, you know, I got other things here. So those are just some of the quotes I threw up there, right? It's like, I don't know if you've said those or heard those, but it's like, wow, man, it's like there's a lot of stuff in my way of trying to do what's right, of trying to provide high quality, low cost healthcare for families. And so that's, I think, part of the challenge. So in starting self-fund health is what we're calling it. We're going to go out and help with the whole package, one contract, help employers write their own success story in what seems like brokers and employers have struggled with, maybe wanted to do, but aren't able to do on their own. So we're just getting started in that. When it comes to problems, by the way, right, I mean, I'm a weird mindset maybe, but whenever I see like the bigger the problem, the more excited I get. Like, so I just say problems are just opportunities in disguise. Anybody ever think that way? No, Matt, you're smoking something here, right? But so when I see a big problem, it's like, wow, that'd be really cool if we could fix that. That'd be really cool. Don't know if we can, but we could try. So one of the things we did is we did kind of a study. We took these just Wisconsin success stories, and then we just looked at how they won, right? Pat's with Rice Lake Schools. We looked at one employer on the eastern side, another one who had actually started back in 10 called Serigraph. Met him, he had wrote a book on it. But we just analyzed those, and what was interesting is those success stories almost mirrored one another. They're not identical because they have their own companies, but very, very, very similar. So that's a good thing to know, right? So if you're an employer, broker, or you're looking at maybe helping an employer, if you're a provider, you still need them to be able to access you. There's still stuff in the way, plan designs and so forth, networks and all sorts of things. But here's some things we found. So there's the lack of transparency in everything creates confusion, right? Not just provider pricing or system hospital pricing, but even the contracts that an employer signs with, starting with the brokers, next to TPA, PBM, those need to be transparent as well. What am I paying for the services? And we put that under fixed cost, right? And then you have variable costs, medical claims, pharmacy claims, et cetera. But the fixed cost is often unknown, and make sure, one of the things you want to do is make sure that no one is being incentivized or rewarded if your claims go up. No one should make more if your claims go up. Sounds small, but it's like, right, if someone's making more when your claims go up, what are they motivated to do? Certainly probably not lower them. Doesn't even have to be incentive pay, it could just be a flat fee, but just make sure they're not unintentionally rewarded if you get worse. That's not the person I want on my team, right? So restructure that. It may not be the person, it just may be the status quo thing. Just restructure that. Here's a kind of a bold statement. There's no way, I'll say this, and if you know of a way, by the way, send me an email or something or see me afterward, but there's no way to win being self-insured. Sorry, there's no way to win being fully insured. I said that wrong. There's no way to win being fully insured. That if you have stories, right, if you have a good year, as in low claims, the price goes up. Maybe it's voiced that it's not as much. If you have a bad year, well, look out. If you have a good year, well, it's 5 years, you know, da-da-da. But it always goes up. Good year, 13%. Bad year, 20%. How are you going to win at that game? So we see a lot of smaller employers, the ones fully funded, they just stop. They're just like, I can't do it. I'm done. Go out in the exchange or whatever, I'm done, right? That's not good for our country. And then being self-insured is the first step to success, but just, right, that's just a step. What that does is say, now if we save money, we actually win. We can make our plan better, lower our deductible, lower our premiums. But self-funded is the first step, but it's just the first of many. And then you want to do stuff so you can actually win. The actual themes for the winning strategy, we can talk about this. But so the first one is a lack of clear strategy, and we'll get into detail. That's kind of the focus of this presentation. What is the winning strategy? I mentioned when we analyze the success stories, they're similar. So what is that? And how do you do it, right? And then second, the many separate partners. So by partners, we mean broker advisor, TPA, PBM, network, stop loss, et cetera. Making sure they're not incentivized in the wrong way, but do they know each other? Do they work well together? Do they all have the same goals? And then even presenting one clear message to employees, right? It's like they're totally confused. Who does what again? What's a TPA, right? So just overwhelming stuff. Challenging stuff for employers. Kind of like, feels like nailing Jell-O to a tree. Anybody ever tried that? It's not fun. So, all right, traditional care paths. So I made a couple visuals. This was during that. And I think the visuals help. Anybody like pictures? So I had first had this really great strategy. Yeah. And it was 5 pages and it was all in writing and I was all excited and I sent it to like 100 people, like literally. Look at this. This was like way back in 16 or 17 and I think like 0 people read it, like literally. My own team didn't even respond. Like, but then I got on my whiteboard and I knew this artist who could draw by hand and on graphics and I'm like, let's turn this into a picture. Then I sent that out and everybody got excited. Keith Smith's like, can I use this? Right, so here's that. So I just think this tells a better story. So is anybody living this right now? So the narrow network, by the way, is, right, if you don't have a narrow network, you get 40% off. And then if you sign with us, right? I fell for that for many years, and then it hit me one day, 40% off. Okay, of what? Well, that's just gag clause, sorry. So how about 95% off? Because it means the same thing to me, right? And plus that charge master, that price list moves, and it can move any day. So that 40% doesn't mean much if we don't know. We got to tie it to something. So preferably we'd speak in a percentage of Medicare. That we can figure that out, right? Anybody ever heard of Sutton's Law? I literally just learned about this on the way here, but it was interesting. So there was this notorious bank robber named Willie Sutton in the 50s, and he robbed a bunch of banks. But apparently this story is unclear. Some say he said it, some say he didn't. But they said, "Why do you rob banks?" And he said, "Because that's where the money is," right? So great answer. So they became Sutton's Law, and it actually got translated into medical, where they said, how do we solve a problem? When looking for an explanation or diagnosis, consider the obvious first. That's like Sutton's Law. And then kind of you could say, well, then follow the money. So in healthcare, whenever you want to understand something, just look for the money trail, right? So if I unknowingly sign away my ability to shop as an employer, ooh, narrow network, 40%. Yeah, where do I sign? Now I can't shop anymore. Oh, they got me. So that's not a good option for us, for employers or brokers, right? So here's the better picture. Right, you see we still have the systems. I mean, they still offer things. You might say things like ER, intensive care, babies. Babies might be able to be interrupted. There's maternity things going on. It's not easy, but so there's some things you never say never, but okay, we can carve those out for now. But what if we could carve everything else out? There's different terms for that. Bolt on, carve out, but interrupt the path. So we see this visual plan design. If your plan design has free options for members and then cost options, that's a good way. Tiered, 1, 2, 3 tiers, 2 tiers, 3 tiers. So that's what plan design can do, because then you say, well, you get a choice. If the plan pays more, then you pay more. Me too. But if the plan pays less, you pay less, or maybe it's free. So if you go by that, then we interrupt. So hospital systems use primary care. I'm not sure it's even primary care anymore. 7 to 10 minutes. You got to interrupt the patient and you got to refer them really fast to 2 or 3 places. It's not really primary care. You're referring as much as 40 or 50% unnecessarily. So DPC quality is much better. They can spend the time, they can do the procedures they need to, and they'll only refer when necessary. And then if they do, now we have our own funnel. So the other funnel that collected them all and spun them all off into different directions, really expensive directions, we interrupt with our own funnel. And then we can use our plan design to say, we have free options for you, really high quality options. As far as Oklahoma, we'll give you a couple grand to go there because the plan will save 7. Or Indiana now, or in our case, Green Bay, or, so we have local ones too. But free options. And guess what? In my experience, over 9 out of 10 will take it. We're not forcing anything. So here's your options. Here's what it will cost you. You can go even to the system if you want. But that one will cost you like 3 or 4 grand based on the plan, however you set it up. But over 9 out of 10, people told me once, they said, we were sending hip replacements, right, to SEO. And I was sitting in a meeting, we just started, and they're like, it's an hour and a half from us. They won't go to Green Bay. Who's going to drive to Green Bay? I said, they're flying to Oklahoma for hip replacements. How inconvenient is that, right? Can you imagine getting a hip replacement, sitting on it? We put them in first class, but still. So we pay for the flight and the hotel and so forth. So they will do it. They will do it. If there's any question, you just got to set up the right circumstances. But these are the independents that we need to support, the ones that tell us the price, and that cost is typically inversely related to quality in healthcare. So typically if the cost is lower, the quality is better. So you're not sacrificing quality. But you got to lead your folks through that, right? I had one person, he was a joker, and we're friends, but he was an employee at Merrill Steel, and he's like, so is this like Motel 6, ask for Vinny in the back, right? Like room 16, right? And he's being half funny, but he's being half not funny. I'm like, no, let me talk about this a minute. Right? So you got to lead them through that because typically we don't pay less and get more. It just doesn't work like that, right? But this is a scenario where we do. Yeah.
So the way you're saying that you sell it is you have to show to the consumer, patient, that how much you are saving them. You can still do all these things, but you think, why would you do this for me?
Yeah.
But because you're saving them this much on the total.
Yeah. I have a chart that I put together. Send me a note, LinkedIn. I'll send it to you. But I would go through that there's like 5 options for surgery. I'll tell them every detail. I'll say, this is how much it actually costs. This is what the plan or company is paying. This is how much you would pay. Here's the quality. And an interesting example, like SEO on the left, Indiana, right? Local, or hospital systems even in there. The lower the cost, the higher the quality, like perfectly in those cases. But I'll go through and I'll say, because we can get a hip replacement in Oklahoma for 16, it's like 70 grand here. Where's the value for that for the company in that 50, the difference there, right? Where's the value? There isn't. There isn't value. When we were doing the on-site MRIs, we were paying the truck $600, and that's common. We can get that in town now as well, but we were paying $600 for the MRI. If that truck drove 20 minutes later, drove to the hospital system, that same truck, that same MRI would cost the patient $5 grand. Same truck. And who's pocketing the $4,400? Not the truck. Truck's still making the same. So, all right. One of the misunderstandings, and I'll move on, one of the misunderstandings about this is that people get overwhelmed. They often, first DPC, get people comfortable there, and you start talking about all this referral, they're like, I can't process this. But once they're ready, they feel like, I think maybe you're feeling this way, like you got to do it all at once. Just start small. Just start with imaging. And a few months, yeah, this is working pretty well. Okay, we'll go to ortho next. One of the things I did, you can look at last year's claims, but you may get a claim you won't have for 10 years. I went to a network in Wisconsin that has over 100,000 members. I said, what's the top 5 costs? Because that's what I want to interrupt first. It was ER, which can't really interrupt much. Then we said, okay, number 1's imaging, 2's ortho, 3's cardio, 4's oncology, 5's babies. Oh, okay, we're going to work, and that's my best odds, isn't it? That's my best odds of interrupting. And where they're making the most, I'm spending the most. So if I want to Pareto this, then I can save the most. So the puzzle analogy, as my new business partner and I were talking, we're like, man, there's a really complex puzzle. Why aren't there success stories? Because there's a really complex puzzle. Now we've simplified this, but it's to make a point, right? I'll talk through some of these. So, but maybe this is why there aren't the success stories, because it's like, wow. And everything up there, but this isn't like for show. Everything in this list is really important, right? It's like 2 mosquitoes, and you look at these and you say, wow, these are all really good things, right? And you get excited. Might be like the 2 mosquitoes that happened upon a nude beach, and one mosquito says to the other, well, I know what to do, I just don't know where to start, right? So, maybe not. But, so these are a lot of good things. So we'll go through a few of them. So I did some circles. Let's see. Whoops. Oh no, my circles didn't work. Okay, well I'll pick them out. So I had a little animation where we just talk about some of the key ones. I'll just pick them out. So early stages, one of the things, change management theory or effective change management, maybe you've started a journey, maybe you want to start a journey. I'll tell you one thing not to forget about. This really will make your journey smoother, is that, right, if I have a destination, if I want to drive, I'm flying back to Wisconsin tomorrow, but if I want to drive from Texas to Wisconsin and I just jump in the car, right, and you say, no, you say, wait a minute, Wisconsin's great. Let me tell you, not in the winter maybe, but Wisconsin's great, and we got rivers and trees and some of the best hunting. Wisconsin is pretty cool, just when it's not 30 below, which it did get to this year. But if all you talked about was Wisconsin, maybe it's even greater, not just a trip. Hey, go home tonight and say, hey family, we're moving to Wisconsin. Wisconsin's great. And let's sit down for 30 minutes. I'm going to tell you how great Wisconsin is. Right? What kind of reaction do you think you'd get? I ain't going, right? So one of the things with change management is we got to talk about, now Texas is great too, so I'm just making this up, but we got to talk about why we can't stay here. We say, well, for the last 3 years, there's been a flood and our house was half underwater and I just lost my job. And all these reasons why we can't stay here. Because once I let go of here, then I'm all open for new ideas. But often we talk about this in private and in management or leader meetings, and we're like, yeah, we've already decided we can't stay here, so then we get excited about where we're going, and then we get in front of the people we're leading and we say, we forget about the let go part. So just a little nugget for you. Get them to let go first. Take the time to talk about why you can't stay here. That's fairly easy in healthcare. But you got to take that step. So before you do anything, once you determine to make a journey, so that's lead change well, like in the upper corner there. Have a game plan. You wouldn't drive to Wisconsin without a map unless you're like, maybe it's a fun road trip. We'll just head like northeast and we'll get there eventually. That's not very efficient. Might be fun, but have a game plan and a map. It'll change along the way. Your partners are key, right? So TPA, PBM, that's half of it maybe, right? If you find a really strong independent TPA that can do maybe like, the TPA and PBM can maybe do almost half of this list. And they'll just do it for you with the right coordination. I'm being general here, but, right? So it looks complicated, but then we put that under streamlined administrative efficiency or something, or streamlined administrative processes, that they will do a lot of it, yeah.
Can you name some of the players? I know some are here, but.
Yeah, I mean, we've been looking at like for this, what we're talking, we're talking about offering this full package in self-fund health. So we said, how about we pick some duos, right? Kempton and Southern scripts work really well together. They know each other, so we don't have alignment issues. So that could be one thing we offer. There's one in Wisconsin called Prairie States, and ProAct and ScoutRx are a mix. They work together. They know each other. So that's sometimes even an advantage, not even just one, but then two that work together, and they're among the best of the best. But your partners are key. Early in the Merrill Steel journey, I drew on my board, I drew like 6 partners. Everything from broker to, right? And I said, who thinks like us? Like who, and by thinking like us, just who wants to change, who's open to change, and who wants to try to do something fun here? Cool. And only one on the whole list, and that was just the new DPC we had just contracted with. But everyone else, it's like dead weight, they don't get it. So we ended up having to switch. It's not easy, right? That's part of this change process. But how are we going to win if we're like dragging everybody with us? We need them to go. We need them to help us. So partners are really a big part of that journey. They don't need to be perfect, but they just need to be good, and they need to think like it. They want to, we're willing, open to change, etc. There's a couple themes. I thought there'd be a lot more, but as we map this out, a couple themes, transparency and everything, I covered that, right? Both with your partner agreements and in pricing. There's a phrase, transparency is the currency of trust, right? Makes sense, right? Without openness, we don't have trust. So if someone, I've done this, I've called and, hey, we're in this network, how much is the price for this? It's too complicated. I can't tell you. And then I got transferred. I was talking to the CEO. It's too complicated. Okay, right. SEO doesn't think it's too complicated. So it's not. There might have been a gag clause. But how can I trust you? If you want, how can I shop? Right? So that's a big part of it. The other theme would be like shopping for cost and quality. We had a really cool discussion on value. But the simple definition of value would be, low cost, high quality, accessibility, maybe. So we need to be able to shop for value, not remember the one lane road? That's not shopping. We have crappy service, we still go back, that's not shopping. It's really important. Being self-funded would be one of the first, right? If you can't, there's creative options, you can explore those, but self-funded means that if you actually do well and do some cool things, if you lower claims, then you actually get to save money instead of someone else pocketing the money from all your hard work, like an insurance company. So probably one of the smoothest ways from the medical side would be DPC. I'm guessing you're probably familiar with that, but right, that's one of the smoothest ways for employees and members because you're increasing the quality of primary care like tenfold. You're not putting them into this spinning wheel that's going to send them 3 places that they could have done in the office. So you're eliminating 40 to 50% of unnecessary referrals. There's cost there and quality because I don't need to take off work again and make another trip over here and spend more money. So huge quality increases with the DPC. And I was going to ask this earlier, but anybody know? So you could say everything up here, fun question, this is kind of the title. Which one of these puzzle pieces will save, from an employer perspective, will save me the most money?
Yes.
What's that? Yes, okay, that's a good answer. There actually is one, isn't it? Yeah. They all will, they're all good though, right? But there's one, and that's kind of a theme, yes. Yeah, so the answer is kind of yes. But like, there's a more specific step that will save you the most money. Everyone's like, what is it? Well, not what's on my mind, but yeah, they're all important, so there's no wrong answer here, I'm sorry.
Say pharmacy still.
Could be actually, that's not what's on my mind, but could be. If you have really high specialty drug costs, for instance, a good PBM, usually if in a normal pharmacy situation, it used to be like 4%. It's now about 25% often of your total claims as pharmacy, and a good PBM can cut that in half.
For those of us with less than color vision, would you mind just going across the board and reading those out?
Oh yeah, Yeah, we can do that. Let's finish this thought. Yeah, kind of small, sorry. So,
Plan design?
yes, I don't know, I shouldn't have, they're all right, yes. Okay, that's really, if your actually answer is the best. There's one step in particular, just if you really break it down, but yes, that is a key part of it because what the answer that's in my head can't work without that. So I'll share what's on my mind, is the secondary or what's called specialty referral. From an employer, all these tie together, so those are all good answers. But that's where you'll save the biggest money on that specific step. Now you need plan design to do that. You also need DPC to do that. Why? Because I get to spend $600 for an MRI instead of $3, $4, $5 grand. I spend 20 grand on a surgery that would have been 70 or 80. That's real money. That's if you're self-funded. By the way, I told this to even owners in the past. They didn't even know this. Like, you're writing a check for this. This isn't some imaginary insurance company. You're writing a check for that if you're self-funded. There's stop loss, but yeah.
Is that simply because you're intercepting the patient before they have a relationship with who they're being sent to?
Yeah, exactly.
That's such a crucial part
Yeah.
of healthcare. It's honoring that element of trust that the physician has with the patient.
Yeah, we're having our own funnel. We're interrupting is the word I use. Some use disrupting. People call me a disruptor and they're complimenting me, and I'm like, that sounds like I'm a troublemaker, but I'm an interrupter. Yeah. But we interrupt that chain and then alternative nation.
Because you created the plan, the portal, for those types of patients instead of just putting them to the hospital system.
Yeah.
You've already developed relationships with surgery centers.
Yeah. Yeah, and like this SEO, you don't need some special direct contract. I called Keith for the first time. He said, we can start tomorrow. Right? So not all like that. Sometimes you need a direct contract. Yeah.
So, quick question. I'm a DPC owner in Las Vegas. Being in Las Vegas.
Okay.
Not much free market stuff there. We just started a free market chapter in September. And when I was opening up 5 years ago, I took some patients from the hospital who followed me over to my DPC clinic. And one of their sons, I didn't know at the time, came in to see me, and he owns a business, about 300 employees. And we treated him really well. He has our trust 100%. He sends us his wife, his kids, he sends us everybody.
Nice.
And then he started sending us his employees, just on a one-by-one issue when they call in sick. And so he showed up one day and he was like, this is my benefits person. Can you guys help me fix things? And then he left. So I sat down and talked with her for a long time, explained to her DPC and everything. And she's like, okay, well, what do you do for deliveries? What do you do when they need
right. Baby deliveries? Right.
She started asking all these auxiliary things from DPC, and she went back to her boss and said, he's got a great little clinic, but it's just him.
Right.
You know? And so that was a couple of years ago.
Yeah.
Right now we've got more connections.
Right.
But how can we, as small DPCs, help get employers?
Yeah, that's it. Would you agree? I mean, and this is even a gap. So we're looking at having an employer conference, maybe as soon as next year, like a national, because what is the gap in fixing American healthcare? Employers need to wake up and get in the game. If you're here, kudos to you if you're an employer or a broker supporting an employer. But that's the gap. So because they get overwhelmed. So like if we take this, right, don't make it harder than it is. If my default, I want to make that the dirt road, but if my default's the system, I'm already playing that game. I'm not losing. I'm losing that's a losing game, but I'm not losing any more. So if I interrupt, I start with high quality primary care, I can save 10 to 20% right there because I'm not referring unnecessarily, even without the referral yet. I'm not referring unnecessarily and I'm getting better quality care. But that's where we want to start small. So like we have this impression like, well, you can't do babies. Yeah, you're right, I can't do babies yet. But let's start with something small. Let's just start with imaging. Let's start with an MRI. We'll just interrupt that. And everything else will still go to the system, as hard as that is to say out loud. But everything else will still go to the system. It's kind of like the fully insured. I would say anytime you use the system, you are losing. They don't tell you the price. You get huge bills, coded, hard to understand, and you pay too much. So if that's our mentality, one by one, and guess what? When you do imaging and you pay that $600 instead of whatever, guess what? They'll like that. And then when they get comfortable, then let's go to ortho next. There's bigger money there. And you only need one provider, by the way. Like, we don't need 10 providers. I only need one imaging that's in the area. Now, if you got 5 locations, okay, right? That's why we're going to jump in and help with all those things. But, yeah.
So you're an advisor, right? A broker?
I'm not a broker. No, we're actually, but I'm an employer, but we're going to provide that one solution. But yeah, we're not doing the broker part.
So you
but
don't like disruptor, you want to be called an interrupter?
I was being humorous. Yeah.
I'm following.
Okay.
Stereotypical.
Yeah.
HR does not like disruption.
Right.
Or interrupter.
Right.
So once that example you just gave was after they said yes,
Mhm.
and they're seeing the results.
Mhm.
How are you getting them from what you know to what they don't want? Which is
Yeah.
interruption and disrupt, just leave it status quo.
The HR folks,
Get
yeah.
past the lazy loader.
The
How do you do that?
I was not your typical. If you're here, you're probably not typical HR, maybe. But yeah, that is a stereotype of typical HRs. They try to so-called keep everybody happy. Don't change anything. Well, where we are in healthcare today, and we slowly got there we're dying from a paper cut for 20 years in a row of little tiny bad increases. Like, that's not keeping them happy either. That's a bad end. That's a bad result. So what we've done in central Wisconsin is we've just held employer events, and they've watched. People said, yeah, everybody's watching you, Matt, what you're doing. Everybody's watching you. You ever heard of, I don't have a picture of it, but Rogers, it's called Rogers Adoption Curve, where there's like 3% innovators, and then it goes into a group that's early adopters, and then it's later adopters. I would say most people aren't the 3% innovators, but that second group, the early adopters, is pretty big. I would probably be an innovator, because I'll just go. It's fun, right? It's not fun for some. But I was talking to someone from one of the bigger companies in Wisconsin. We were just starting to refer to SEO, just about to, as an option. Never forced anything. Everybody did it. But I went through it because she had said, I want to hear about this. I thought she was going to be like, yeah, we'll join in with you and we'll start trying it as well. And you know what she said? She said, all right, thanks for all that information. When you get that going, give me a call, right? So that told me that she was later. She was either early adopter, maybe a late adopter. But I think that's where a lot of the HR folks are. They're just scared. They're like, because is there risk here? Is there risk? And now I would say this path is proven. This is not an experiment anymore for me, but it was a little bit before. So Pat and I have shared stories where were our jobs at risk at one point? Yeah, a little bit. But I don't think it's because you get the feedback in that middle of the journey where it's really hard. The end is far in sight. You're past the fun part of starting, and you're in the middle of the desert, and like, oh crap. And yeah.
The one thing, I'm half the HR and CFO, so I kind of work that way. But I still get the CFO and the owner and get the message that I'm getting a better chance.
Definitely, or getting to the.
Right.
Access and time.
Right, because
Yep.
show me the money is where they see the words,
Someone.
The owner, so if there is an owner, for a school district, or board, show them the money, and they're going, hey, how can we not do this?
Someone mentioned yesterday, and someone mentioned it, the little puzzle today, right? Executive buy-in, especially at least the owners or president. You don't need every person, but that's important when you start to get a little difficult feedback, because it'll happen. Something will go wrong. Not big, but protection. That person, hold on, we knew this was coming, da da da. So we can kind of run, so executive team buy-in, I've said a lot of these, TPA, determine assertiveness level. I like to do the beginning. You want to be assertive? You want to be like slow or mild, or, right? How aggressive do we want to be? Somewhere in the middle. Strategy, game plan, lead change well, transparency and everything, shop for cost and quality. A change agent. I don't know if this is so important, probably still, especially when it's a new movement, right? So you have every movement, if you look at every movement, whether it be national or just within a company, there's a change agent, is what I'll call them, a disruptor. There, behind that, right? So it's somebody who's willing to shake the tree a little bit. it's important. So if you're not there, then follow a proven practice. But when it's really when the path is uncharted, it's a change agent. Or even now, even in your company, who's your change agent? Maybe it's you. Stop loss is a big part of the self-funding. The plan design we covered, DPC we covered. You can have virtual and so forth. Proactive wellness would come maybe way at the end, in my opinion. It's mushy. I don't know if it has an ROI, but it's a good thing to have is maybe eventually. System contracts as a backup, even if you're going to try and steer away, you still need those system contracts. Yep.
So I can see the advantage, and not this is the way I've equated it, this is my first experience with DPC, is I couldn't even see the puzzle before. But what you're showing, I see the puzzle pieces now.
Mm-hmm.
And just how you put in what order to finish the puzzle. My question is there is a point where you have the puzzle complete.
Mm-hmm.
Will you need to format or network with all these companies forever, or do you take any of that upon yourself and building it from within the DPC what you created?
You're talking about like our company or just in general? In general, yeah. So I think you're going to need those core, TPA, the traditional, but an independent modern TPA like a Kempton or whomever, TPA, PBM that know each other's good, stop loss, transparency and everything. DPC, you might have one choice, you might have 5 choices. Pick somebody that thinks
Tiers in the service?
in the plan design.
Is that
So how you, in the plan design leads before, that's how everyone makes decisions of where to go and when to go. And yeah, so you see how these people, now we have this clarified and there's only so much time today, but under headings and kind of how these, I'll even more clear, this is kind of, right, it's just meant to explain the key pieces, but there's even a better way to organize these so it becomes more clear, which I'm glad to share that if anybody wants, let me know. But there's a lot of pieces that are really important, but maybe wouldn't have made the circle. I had a slide, I was going to push the button and it circles about 10 of them, but nurse case managers, there's lots of detail here. We just don't have time to get in to today. But these are the key pieces of the puzzle, in my opinion, and based on our study, yes.
I feel like it's important to maintain a separation between each of these entities in order to prevent this systematization and a return to what we were doing, what we've been doing. You know what I mean? Like TPA here, PBM here, DPC here, and not conglomerating them.
Yeah.
It's easier because it's more.
I mean, they're interesting, yeah. They're separate entities, right? But
There's that. Inevitably, somebody's going to do that.
yeah, that's kind of where we're going, right? But
there's a risk there when you
there's,
tyrannize
yeah,
the system.
right. There always is risk, and I think I would just say that's just your yellow caution flag. How am I doing on time? Oh, yeah. All right. So I'm at the end. Sorry, question. Yeah, thank you. I just call it Animal Farm. Everybody ever read the book Animal Farm from George Orwell? Like the pigs, the farmer's not treating them right, so then the animals talk, of course, but the animals take over the farm. The pigs are the smartest, and then the pigs eventually turn corrupt, and then you have the same issue. So we have to caution always against when the good guys become the bad guys. Most of these hospital systems start as nonprofit, benevolent, selfless community organizations, and they're not there today. So yeah, just guard against Animal Farm. And just, this is the last slide. So I'll leave you with a couple comments. So there's sign-up sheets back there. If you'd like to put your name and email, I won't flood your inbox, maybe one a month, but this is a way to learn. It's a way for us like-minded folks, kindred spirits to be connected. And I would just end kind of like my unexpected speech yesterday, and that wasn't planned, of course, but I call it the trifactor. Not the trifectas in horse racing, not the trifactors in the TRY factor. That, right, like lots of quotes. Vince Lombardi said, "We've never lost a game. On occasion, we ran out of time." Right? Wayne Gretzky said, you miss every shot you don't take. George Halas said, no one's ever regretted giving their best, right? So that giving 100%, and as they say, give 100% always except when you're giving blood. Don't do it then. But that try factor is like a lot of this. So if you're a change agent, or maybe you want to be a change agent, a lot of it's just that internal fire and not giving up and working through it. So that time went really fast. So thank you for coming. Yeah.